My heart issues started about 4 years ago, and they called an ambulance. If you have heart problems, they're going to turn around and send you down to AtlantiCare anyway. So let's just take you right there. So that was my first experience with AtlantiCare Heart. I guess it was about a year ago, I had AFib. That's when I found out I had a leak in my Mitral valve, and I met Dr. Van Hook. And he said, well, it's pretty serious.
Most commonly, patients with a leaky mitral valve will have fatigue, shortness of breath. They may have swelling in their legs. They could get palpitations, or they could have shortness of breath when they lay flat, or may even wake them up from sleep and they have to sit upright to make their breathing better. The mitral valve is a valve between the upper and lower chambers of the heart, and its job is to allow blood to go into the pumping chamber but not backwards. And sometimes, because there's a problem with the valve, one of the leaflets may come up this way and blood will leak back. Or if there's a problem with the muscle, the valve can get pulled apart and not come together. So with the MitraClip, we are making the blood flow in the correct direction and making the patient's symptoms better without surgery.
I went through tests, and fortunately, I was a great candidate for a MitraClip. And I went in the hospital, I guess about 8, 9 o'clock in the morning, and they put this clip in, and no problems at all. No scars, no cuts. They went in through my leg, and I was a little bit bruised there, but it was a heck of a lot better than getting cut open, that's for sure.
So when you have a MitraClip, really the only incision you have is actually a needle stick puncture in the groin. So there's no chest opening, there's no large incisions. So most people go home the next day. They're out of bed a few hours later, they go home the next day, and they're back to basically their normal life within a week. The biggest benefit of having the MitraClip available in the southeast region of New Jersey is they can be treated close to home, close to their families, by a complete comprehensive team. There's an interventional cardiologist, cardiothoracic surgeons, imaging and clinical cardiologists, cardiac anesthesia, all working together. So if someone thinks that they might be a candidate for this, they can call the AtlantiCare Access Center and be plugged directly into our structural heart disease clinic. But the best, most efficient way is to see your own cardiologist and let them evaluate you and see if they think that you have a leaky mitral valve, and they'll plug us in and get you the care you need.
Since then, I really feel great. I mean, I can do things I haven't done in a long time without getting out of breath. Now stairs are not a problem. Before the MitraClip, I tried to ride my bike. I got about 4 or 5 blocks. Now I'm back to 5 miles almost every day. I'm a real avid fisherman. I have a 25-foot boat and a 16-foot boat, and up until last year I was actually thinking about selling them because I just didn't have the energy or the desire to get out there and fish again. Now I'm thinking about maybe buying a new boat.